So now let's take a look at the ureters, the urinary bladder, and the urethra. You can see all these organs shown here in the female anatomy. We will also look at them in the view of the male anatomy as well, and you'll see there are a few differences there. But let's look at the female anatomy first, and we'll start with the ureters. So the ureters are very muscular tubes. They're made of smooth muscle surrounded by some loose connective tissue. And then on the inside, they're lined with mucous membranes, transitional epithelium, which has the ability to be able to be stretched. Now, when urine enters the ureter, it causes it to stretch a little bit, and that will trigger contractions of the smooth muscle layer of the ureter. It will actually trigger what are called peristaltic contractions. So this peristalsis, this wave-like type of contraction, will help push that urine through the ureter down finally into the urinary bladder through these ureteral openings here on either side. And you can see that those two openings joined up with the urethral opening form what we call a trigone. So this is a triangular shaped region within the bladder in between those three openings of the bladder. And as we were talking about with the ureters, again, those peristalsis contractions help push that urine down into the bladder. But the lumen of these ureters is going to be very small, and so it's also very easily blocked by things called kidney stones. So if you've ever had a kidney stone, that's also known as a renal calculus. It's made of calcium deposits, and those can accumulate in the kidney, and they can form these kidney stones, these little hard granules that can actually get trapped in the ureter and can block the ureter and prevent urine from leaving the kidney and getting into the bladder. Now, when this happens, it can cause damage to the kidney and or the ureter. That can cause bleeding in the urinary tract sometimes, and it also causes some very extreme pain when those peristalsis contractions happen and try to squeeze that stone through the ureter. It can cause some very extreme pain. And so treatment for kidney stones are going to be either taking medications to help try to dissolve the stones. You could have the stone surgically removed, or you could go through lithotripsy, which is where they do a ultrasound to basically break the stone up and cause it to disintegrate within the ureter and be released that way. So kidney stones can cause some problems in the urinary tract. Now moving to the bladder, looking down here at the urinary bladder, you will see that this is a very muscular organ. It's lined with 3 layers of smooth muscle called detrusor muscle. And inside of those muscle layers, we have a thick layer of transitional epithelium lining the inside, which again is a special type of epithelium that allows for stretch. It allows this organ to be able to stretch. We also mentioned the trigone down here at the bottom, this region in between those 3 openings of the bladder. This is a very common site for bladder infections because this is where urine can kind of be trapped or back up within the bladder. And as I mentioned before, the bladder is very distensible. It's able to stretch tremendously, and it expands superiorly as it fills with urine. So you'll see it's very relatively small organ whenever it is empty, but whenever it's completely full, it can hold up to almost 1 liter of urine. So typically between 700 to 800 milliliters of urine can be held within this bladder. And so it stretches from about 5 to 6 cell layers thick down to about 2 to 3. So it can stretch pretty tremendously. Now, urinary tract infections that we can have, cystitis is an infection of the actual urinary bladder. You can have an infection of the renal pelvis, that's pyelitis, so remember that's up in the kidney, that's where that urine is collected in the kidney. Or you can have an infection of the kidney itself, of the cortex and the nephrons in the kidney, that's called pyelonephritis. Now moving to the urethra is the opening to the outside of the body, which will help remove the urine from the bladder and allow it to exit the body through micturition. Now, when we look at the urethra, there are 2 sphincters on the outside of the urethra. We have what's called the external urethral sphincter and the internal urethral sphincter. So those 2 sphincters are made up of muscle. The external urethral sphincter is made up of skeletal muscle, meaning we have conscious control of it, and then the internal urethral sphincter is going to be made up of smooth muscle, meaning we do not have conscious control over that one. So once urine starts to get ready to leave the bladder, it will put pressure on that internal sphincter which again is made of smooth muscle, causing it to start to open. And then we will consciously keep that external urethral sphincter closed until we can make it to the body, or to the bathroom rather. And then we can consciously allow that skeletal muscle to open up and allow that urine to escape the body. Now you will notice that the anatomy of the urethra is going to be somewhat different between the female and the male. When we look at the female urethra, you will see that it's very short. It's around 3 to 4 centimeters long, and it's found anterior to the wall of the vagina. So this makes it much more common for women to get urinary tract infections because that urethra is so short, and because the opening is relatively close to the anus of the female. You can sometimes end up getting, bacteria from the digestive tract through feces. Will be exposed, or the urethra will be exposed to that bacteria, and that bacteria can get into the bladder and can end up causing a urinary tract infection. In males, however, look at the male anatomy, you'll notice that the urethra is much, much longer because it has to travel through the penis as well. And so the male urethra is typically about 18 centimeters long, which is much longer than the female urethra. And you'll notice it has 3 regions to it. It has what's called the prostatic urethra, which travels through the prostate, which is this organ that you're looking at here. You have the membranous urethra, which is a small segment that passes through the pelvic floor of the male. And then you have the spongy urethra, which is also sometimes known as the penile urethra, which travels through the length of the penis. And so again, a much longer urethra in the male, so that urine has to travel a much longer distance, and it's going to be further away from the anus. So you're going to see it's going to be a lot less likely for a male to have a urinary tract infection than a female. Still, you're going to see the same urethral sphincters. You have the internal urethral sphincter here, kind of right at the base of the bladder, which again, we do not have conscious control over. It's made of smooth muscle. It's involuntarily controlled. And then you have the external urethral sphincter in the male down here, which you have conscious control over, and you can tell that one when you want it to open and close to give you conscious control over your voiding or micturition.